Okay, so we're just talking about what O&M training is. So O&M training is a training that most visually impaired individuals receive, and it's a component of a comprehensive rehab training that designed for individuals with vision loss. The aim of the training is to help individuals travel more safely and independently in their desired environment, often using a long cane or dog guide. And O&M training often includes topics such as how to stay oriented while traveling, using non-visual landmarks and clues such as a uniquely designed fence of a house at the end of the block, or a constantly present sound from a power plant at the southern end of the parking lot. How to use a long cane to protect himself from hazards on their walking path, such as obstacles or drop-offs. How to cross streets safely and independently at various types of intersections, and how to use public transit systems to get to places that's beyond walking distance. There are two main cane techniques that are used by blind travelers. Two-point touch technique, which is swinging the cane side to side, tapping the edges of one's walking path in an arc slightly wider than one's shoulders. It has been the standard cane technique since its development in the 1940s. Constant contact technique, which is sweeping the cane side to side, keeping the cane tip in contact with the walking surface at all times, is also widely used by blind travelers. So cane travel has multiple components, but they can be classified into two main components. The first is the safety of travel, which can be classified into three subcomponents. Coverage, which can be measured by obstacle detection, drop-off detection, and walking surface change detection. And the efficiency of travel can be measured by measuring the time elapsed before arriving at an intended destination. Now, regardless of which cane design is used or which cane technique is used, it is critical for blind travelers to detect drop-offs reliably. A cane user may fall or accidentally put himself in the collision path of an oncoming vehicle by missing a curb. And a failure to detect uneven surfaces such as a pothole or a sunken slab may also result in falls and consequent fall-induced injuries. Similarly, it is critical for blind travelers to detect obstacles reliably. They may trip over obstacles such as construction cones and bricks. They may also suffer collision injuries by missing an obstacle such as a signpost. A number of factors could affect drop-off detection performance, but they can be classified into the following four categories: cane use biomechanics factors, user characteristics, cane design factors, and environmental factors. And so far, we have examined the factors that are either inherent to or controllable by the cane user, which include cane use biomechanics, user characteristics, and cane design factors, while leaving the investigation of environmental factors for future research. And similarly, a number of factors can affect obstacle detection performance. And so far, we've completed the analysis of the factors, so only some of the key factors that belong to the cane use biomechanics and cane designs. So now the methods for the drop-off detection studies. Recruitment criteria included legal blindness with no other disabilities, familiarity with both techniques, that is both the two-point touch and constant contact techniques, at least 1 month of training, and 13 to 16 cane users participated in individual studies. And when appropriate, we combined data from multiple studies for our analysis. The test site was the 8-foot wide concrete hallway in the College of Health and Human Services building basement, and sleep shades and headphone set were worn by all participants during all trials to prevent them from using auditory cues for detecting drop-offs. As you can see in this picture, 8 carpeted platforms, each 8 feet long, 4 feet wide, and 8 inches high, were used to build a 32-foot long walkway. And then additional plywood boards were placed on one end of the walkway to vary the depth of the drop-off from 1 inch to 7 inches with 2-inch increments. And starting points were randomly varied from 14 feet to 30 feet from the drop-off to prevent the participants from anticipating the drop-off at a predictable distance. 64 to 96 trials were completed per participant in each study. And block randomization was used to prevent order effect and also to randomly select drop-off depth for each trial. And here are some key findings from our drop-off detection studies. The constant contact technique was better than the two-point touch technique for detecting drop-offs, and such advantage was larger for less experienced cane users than more experienced cane users. And younger cane users were better than older cane users for detecting drop-offs. And the individuals with earlier onset visual impairment did better than those with later onset visual impairment. And a heavier cane was better than a lighter cane for detecting drop-offs. And the standard length cane, which is the cane that comes up to 2 inches above the xiphoid process when put vertically in front of you. So that standard length cane was better than extended length cane, which is 16 inches longer than the standard length cane for detecting drop-offs. And standard cane swing arc width, which is swing the cane as wide as your shoulders, was better than the extended swing arc width, which is of swinging the cane a foot wider on each side than the standard cane swing arc width with respect to detecting drop-offs. There are some factors that did not turn out to have a significant effect on drop-off detection performance, contrary to our hypothesis that a more rigid cane would allow cane users to more reliably detect drop-offs. The cane shaft rigidity did not turn out to be a significant factor. Type of cane tip, at least between the marshmallow tip and marshmallow roller tip, did not turn out to be a significant factor for drop-off detection performance. Now the methods for obstacle detection studies. The recruitment criteria were the same as described for drop-off detection studies. And the test site was Western's College of Health and Human Services building 4th floor hallway. And the sleep shades and headphone set were worn by all participants during all trials. As you can see in this picture, cylindrical objects of different sizes, that is diameters of 2 inches, 6 inches, 10 inches, and 14 inches, and different heights, that is 1 inch high, 3 inches high, 5 inches high, and 7 inches high. So those were created with styrofoam and linoleum, as you can see in this picture. And the objects were presented either at the midline of the walking path or slightly off to the side following a randomized schedule. And a 20-foot long rail, as you can see in this picture, that is 3 feet high, built with PVC pipes, was placed beside the walking path for the participants to trail with the free hand. And the starting points were randomly selected to prevent the participants from anticipating the obstacle at a predictable distance. 128 to 190 trials were completed per participant in each study, and block randomization method was used to randomly select obstacle size and height for each trial. And here are some key findings from our obstacle detection studies. The constant contact technique was better than the two-point touch technique for detecting shorter obstacles, but the performance between the two techniques was similar for detecting taller obstacles. Bundu basher tip, which is the tip you see on the left-hand side in the picture, was better than the marshmallow tip, which is the tip you see on the right-hand side of this picture, for detecting obstacles. And we suspected that the Bundu-Basher tip's larger contact area with the walking surface allowed it to detect the obstacles more reliably. In other words, the whole middle section of the Bundu-Basher tip made contact with the walking surface, whereas only the tip of the marshmallow tip actually made contact with the walking surface. And that allowed the Bundu-Basher tip to detect the obstacles at a higher percentage. And the cane length and cane swing arc width did not have a significant effect on obstacle detection performance. Now the overall discussion. One of the most significant and prevailing findings of our studies is the presence of the constant contact technique's advantage over two-point touch technique in drop-off detection, and to an extent for obstacle detection as well. And particularly noteworthy is the large effect size of such advantage. For example, the 50% drop-off detection threshold of the constant contact technique was only half as large as that of the two-point touch technique. By the way, 50% drop-off detection threshold is the smallest drop-off depth that could be detected at least half of the times. In other words, the smaller the threshold, the better the performance. And even for large drop-offs, that is 5-inch and 7-inch drop-offs, participants still missed 1 in 15 of those when they used the two-point touch technique. But they missed less than 1 in 100 of those when they used the constant contact technique, a noticeable difference. Now, one of the rather surprising findings was that even for 5-inch high and 7-inch high obstacles, which if missed are likely to trip the cane user, participants still missed 1 in 3 of those obstacles, regardless of which technique they used. And that was surprising because that is contrary to what the O&M instructors have been taught, which is that as long as you use either the two-point touch technique or the constant contact technique as prescribed by the textbook, you can reliably detect the obstacles that may trip you. However, if you look back on literature on this topic, our finding is consistent with Mark Uslin's finding, who reported a path coverage rate of about 69%. Now, with the Bundu-Basher tip, the bent tip that we saw in the previous slide, with the Bundu-Basher tip, the participants missed the obstacles about 25% of the time, which is a noticeable improvement from missing them 35% of the time with the marshmallow tip. However, still missing these obstacles 25% of the time still raises the question of whether we should further modify the cane design and also the cane technique so that we can enhance the cane designs and cane use biomechanics inherent ability to detect these obstacles more reliably. Now, currently, we are testing to see whether the findings whether our lab setting findings hold true in more ecologically valid environment as well, such as the actual sidewalk with surface irregularities. In fact, last weekend, we just collected the first batch of drop-off detection data on an actual sidewalk here on campus. In the near future, we plan to examine what biomechanical and ergonomic factors affect the person's ability to detect sudden changes in walking surface texture, and also how fatigue might affect how cane user is able to detect different hazards such as drop-offs and obstacles. So I'd like to, among others, I would like to acknowledge the following people for their contribution to our studies. And you can find the details of what I presented today and a lot more from the articles published in TRR, Human Factors, Ergonomics, and so on. Thank you.